Hello, my name is Dr. Bob DeMaria, the Drugless Doctor, and today we're going to get to know about common conditions that I know men live with every day and nobody seems ever want to talk about the answers to these problems. Well, I want you to know pain brings men into our office and that millions of people wake up every day with pain. Most men suffer with some type of low back pain. If you have low back pain that is sharp pain means ligament involvement. You may have strained or sprained a ligament in your lower back from either bending and twisting and picking something up. If you have low back pain that's dull means muscle injury, muscle damage. Most of the time, low back pain that's dull will go away in a few days. It's self-limiting. Sharp pain's a little bit different. You could have actually caused one of the tiny vertebrae in your lower spine to go out of alignment. Chronic mid-back pain. Pain between the shoulders. Guess what I have found to be one of the leading causes of pain between the shoulders? Are you ready for this? White potatoes. The blood sugar in your body is altered with white potatoes. You could have gnawing pain in your mid-back region because of white potatoes. And right between the shoulder blades, a little bit higher, if you have a desire for pineapple, I have seen that pineapple can cause mid-back pain also. One of the areas that I've been really fortunate to recognize is that what you eat can either cause pain or take pain away. Chronic left neck and shoulder blade pain, mid-back on the left side, is almost always caused by, are you ready? Bananas, raisins, and grapes, and yogurt. Anytime you wake up in the morning and you have neck pain, or anytime during the day for that matter, and your left neck and mid-back hurts, write down what you've been eating, journal that, and see if there's any sweet fruit or dairy products. Another condition that we see commonly is right knee pain, and that can be actually caused from gallbladder congestion. A part of my experience in training has been in Chinese acupuncture, and it's common for us to see individuals have right knee pain associated with their gallbladder being irritated. A couple other areas that I know is quite common with men is wrist pain. I'm going to share something with you that I feel will benefit you, especially if you already had carpal tunnel surgery once. What I have found is that most of the time, people will have carpal tunnel, that's altered function of your wrist, on the preferred side or your handiness side. If you come into our practice, or if right now you're suffering with wrist pain in both wrists, it could be coming from a decayed or damaged disc in your neck. Carpal tunnel pain and tennis elbow and golfer elbow pain can be helped and improved with 150 milligrams of vitamin B6 for anywhere from 3 to 6 months. You could have bursitis or tendonitis in your shoulder. Anytime that you've been told that you have tendonitis, we also use vitamin B6, 150 milligrams a day for 3 to 6 months. Bursitis in the shoulder area also is improved with something that we use called apple cider vinegar. Apple cider vinegar will help relieve a common problem, which is shoulder pain. You know, so many men suffer today, or I should say contend with, another very common condition, and that's high cholesterol. They always say to me, Dr. Bob, my cholesterol is up. What should I do? Very simple. Minimize sugar, minimize trans fat, minimize or eliminate ice cream products. Dairy products have a tendency, especially ice cream, to raise one's cholesterol. Eggs are okay. I eat eggs. My cholesterol is absolutely normal. egg yolk has something in it called lecithin. You know, gentlemen, I also know that you oftentimes suffer with depression, especially when you're around 40 years old. I would encourage you to take at least 1 tablespoon of flax oil per day per 100 pounds. Oil is very important for your brain. A common health challenge with the depression is fatigue also. You want to make sure that you're in bed by 10 o'clock. An area that I see that men oftentimes start to suffer with is their posture starts to go forward. We encourage our patients to get a large ball, a 55-centimeter ball, and start laying back on it 2 to 3 minutes every day. I also know that gentlemen that come into our office have a tendency to have issues with high blood pressure. I'm going to share a little nugget with you. We use something called Celtic sea salt. It's an unrefined salt, and oftentimes we see much improvement with high blood pressure issues because you've been consuming table salt, which is sodium chloride. Sodium chloride can alter your blood pressure. Do you know what else I see can raise a blood pressure? Lack of vitamin D. What about diabetes, gentlemen? Diabetes is the 3rd largest killer of people in our society today. Cut back on sugar, exercise. Exercise burns the extra glucose. Have your HA1C test done. It helps us create a strategy to lower your blood sugar. Discipline is freedom. Drink your water, get to bed with plenty of time, rest, spend time with your family. All these little tips will make a huge difference in some of your common health problems. I'm Dr. Bob DeMaria, the Drugless Doctor. Thank you for joining me today.